On Inside Politics, our guest today is Dr. Melissa Buntin from Vanderbilt University, the Mike Kerr Professor of Healthcare Policy. We're talking about TennCare and the possible move to take it into a block grant program instead of its current situation. Dr. Buntin, Tennessee could have accepted hundreds of millions of dollars in the Affordable Care Act under what's called Obamacare, yet the legislature has never wanted to do that. If they're trying to find a way to get more money and save money, why don't they just do that? They don't even have to worry about a match from the federal government on that.
That is an excellent question.
Is it a political answer? Is it
I
because
think it's a political answer.
Obamacare? It's because it's named after the former president who they did not like. It was a different party.
Well, I'm not going to cast aspersions on anyone. I can say there have been a lot of discussions in this state about paths forward to improve health care and expand coverage, and I think that this proposal does not preclude those conversations continuing. So I retain hope in that area.
Although politically not very likely for it to happen. Unless there's a major change in Washington and a major change in the legislature.
You would know as well as I.
How long are these negotiations going to take? Is there enough time between now and the end of the Trump administration, which could be as early as 2021, and for that matter, all the other things going on in Washington? Is there going to be time to work this out? It sounds like a lot of things they have to deal with.
I mean, this is an unprecedented request, and even major requests like this that aren't even at this level take easily a year to negotiate. So we could be well past even the 2020 election. That said, there's the wild card of it being a presidential election year.
I was going to say, there's a lot of political pressures out there. President Trump, I think, would love to have something like this to be able to go out and say, here's our ultimate way to solve, and we don't need Obamacare anymore. This is the way to go in the future. And isn't Tennessee wonderful? It's a state that's already voted for him in the past and probably will again. Don't they want that kind of a showcase thing to say this is our answer on health care, because they didn't have one in 2018 and it cost them?
I would say if this is going to get through, then that wild card would have to come into play. The Trump administration would have to decide that they wanted to push it through quickly and decisively in order to make a splash.
There's also a question about what happens for hospitals on this, and there's a lot of concern, particularly in the rural areas, that hospitals have been closing in part because they're not getting the money they expected they might get under the Affordable Care Act. So what role do hospitals play in this, and how careful do you have to be because of who your employer is, being the medical center?
Well, I always think about Tennessee first, and then my employer second in this case, because that's my job and that's what they pay me to do. But there are two parts of this proposal that relate to hospitals. One is that the special sets of payments that go to hospitals that serve a lot of low-income and uninsured people are one of those things carved out. So TennCare is proposing
they would not be impacted.
Correct, to leave those alone. The second part is that there's some language in this proposal that acknowledges we really have a problem with healthcare in rural areas and with rural hospitals, and it's one of the things on the list of maybes that more money could go to.
Tennessee leads the nation in a number of these rural hospitals that are closing. Will going to a block grant program make any difference one way or the other on solving that problem, or is that going to have to be solved in a separate way?
I think that requires a separate solution.
So all the dollars involved in this won't do anything to help the rural hospitals? If
the federal government were to agree to share these savings to the tune that TennCare has asked for, then there would be more money in the system.
The Governor Lee has made a big deal of a priority for him to do something about rural Tennessee, particularly to bring them in economically to where the rest of the state is, particularly Nashville and the other areas, Memphis, Knoxville. Does going to a block grant do anything to really help that? Is there a bigger TennCare problem with this in rural areas, or is it more of an urban problem?
So I think that we have people all across the entire state who are low income. They can't afford health insurance, but they make too much to qualify for TennCare. That's a statewide problem. It can be particularly acute in rural areas where there are just fewer opportunities and fewer healthcare providers to go to, period. So this could bring more money into the system, but again, at the end of the day, it's what the federal government is going to negotiate, and we don't know if the terms will be as favorable as what TennCare has asked for.
The governor has appointed a rather large task force to study and make recommendations about modernizing and improving the healthcare system. But that's a totally separate process for the block grant system. That might be confusing to people because you'd think that TennCare being such a major part of delivering health care in Tennessee, that it would obviously be involved in modernization and those kind of recommendations. Why is the governor treating it separately?
Yeah, they are on two separate paths. I can't answer on behalf of the governor. I would say that the block grant was put on a timeline by the General Assembly. They have to submit this request to the federal government by November, and we just heard about the task force last week. But hopefully in the future, the people they've appointed to this task force would be available to help with this
So what are your
effort.
thoughts? What are we going to get back, if anything, out of these negotiations? At the end of the day, what does the governor have to send back to the state legislature for approval in your estimation at this point? I know it's speculation.
That one may be too much for even me to speculate. There was one thing I feel certain about, though, which is that no matter whether we get through these negotiations, we get to something the governor and his team find acceptable and the General Assembly finds it acceptable, I'm pretty sure there's going to be a lawsuit about the provisions. So any implementation of this would probably be years down the line.
Something's going to take off for a long time, a lot more debate about it, and hopefully this will at least bring some clarity for people, at least for the time being.
Yes.
Thank you so much for joining us on the program.
Thank you for inviting me.
I'm sure we'll have you back again as this debate continues. And thank you for joining us on Inside Politics this week. Hope you can be back here again for a future show. If you can't get enough politics in the meantime, go to News Channel 5 website. You'll find my Capitol View commentary there. There's a new commentary posted every Friday afternoon. Enjoy the rest of your weekend, and we'll see you back here next time. Goodbye.